Hi everyone, I'm Dr. Nivedita Dadu. I'm a dermatologist practicing in Delhi. I make informative content on skin and hair, and in today's video I will be talking about underarm pigmentation. I will tell you everything about underarm pigmentation, the causes, the lifestyle issues, the creams available for underarm pigmentation, the home remedies, and the treatment options available at dermatology clinics. First, let's talk about the reasons behind underarm pigmentation. One of the most common reason is the use of deodorants. Deodorants contain alcohol. These are sprays and these can irritate your skin. So you can opt for roll-ons, which are gentler and milder for your skin. The second common reason is the hair removal method that you are opting for. So hair removal methods like waxing or shaving that area or using hair removal creams, these can irritate your skin. So such people can opt for either trimmers or hair removal lasers. Hair removal lasers will reduce the density of your hair, and they will make your hair very fine. You can get rid of 70 to 80% of your hair, and whatever little bit of hair is remaining will be very fine, and you can shave that area once in 4 months. The third important reason for underarm pigmentation can be bacterial or fungal infection. If you feel there is a bacterial or fungal infection, consult your dermatologist and get rid of it immediately. The fourth common reason is acanthosis nigricans. Acanthosis nigricans is a lifestyle issue usually, and it is a problem where there's pigmentation on the skin folds like the neck or the underarms or between the thighs, and when the acanthosis nigricans increases, it can happen on the face also. The difference between the usual underarm pigmentation and acanthosis nigricans is that acanthosis nigricans skin will be thicker and velvety and darker, and so when if you feel that your underarm skin has become thick and velvety and dark, it could be the unusual acanthosis nigricans pigmentation. Acanthosis nigricans is usually a lifestyle disorder, may happen because of sudden weight gain or sedentary lifestyle, and which is why it has become suddenly very common in this pandemic. And if you feel there is acanthosis nigricans, you should consult a dermatologist. Your dermatologist will run certain blood tests like your sugar levels, your insulin, your thyroid, your cholesterol, and PCOS in females. Until you fix the underlying hormonal imbalance or the lifestyle issue, you will not see a very good improvement. So lifestyle modification, eating a healthy, proper diet and exercising is very important. Besides, of course, fixing the hormonal issue, that is the reason behind your acanthosis nigricans. Another common reason for underarm pigmentation is medicines. There are certain medicines that can increase your underarm pigmentation, like insulin, growth hormones, oral contraceptives, and steroids. In few cases, cancers of liver and intestine can also cause underarm pigmentation. Now that we've seen the causes, the lifestyle issues that may be causing underarm pigmentation, let us see the home remedies. So, in home remedies, I would suggest you try curd and honey. Both curd and honey have bleaching properties, they have detanning properties. When you mix the two in equal quantities and apply twice a week on your underarms and wash it off in 10 minutes, you will see some improvement in the underarm area, unless of course it is something severe like the acanthosis nigricans. You can also try honey and papaya. So if you mix equal quantities of honey and mashed papaya and apply on the underarms twice a week, leave it for 10 minutes and then wash it off, you will see good results. Now, besides this, there are certain creams that you can apply for underarm pigmentation. Most of the creams are exfoliating. They are going to remove the dead, dull pigmented cells of the underarm, and you will see a nice glowing skin. So these creams should contain glycolic acid, urea, lactic acid, and one of the creams that I would recommend is Glyco-6. Glyco-6 has 6% glycolic acid, and it's going to reduce the pigmentation. The second option would be Demelan. Demelan has 10% glycolic acid and kojic acid and arbutin. So if somebody has a lot of pigmentation, I would suggest Demelan. I've made a separate video on Demelan, and we will share the link of this video so you will understand the best way of applying the cream so that you don't see any side effects. So why I'm talking about side effects is that most of these creams, 6% glycolic acid and 10% glycolic acid, are exfoliating. They're going to remove the dead pigmented cells. So you have to apply it in very little quantity and also add a moisturizer to prevent the exfoliation If there's hard exfoliation, you will see that the skin becomes red and irritated. So make sure you take very little quantity, add a moisturizer to it, mix on your palm, and then apply it on the underarm area only in the night, and repeat the moisturizer the next day morning. Besides the creams, there are certain treatments that you can get from dermatology clinics that are going to really help you. At our clinic, we are doing cocktail peels or sandwich peels for underarm pigmentation, and these are very good peels with very good exfoliating properties. But since they are aggressive peels, it is suggested that you get these peels only from a dermatologist, from a qualified and experienced dermatologist. And besides the underarm peels, you can also get underarm lasers. So there are lasers these days available that bleach your skin, and these are Q switch lasers. So these are also things that you can opt for. I suggest a combination of underarm peels and hair removal lasers and underarm Q switch lasers for best results. I hope the video was informative. For more such informative content, please subscribe to my YouTube channel, that is Dadu Medical Center, and you can also follow me on Instagram. My Instagram handle is Dadu Skin Clinic.